The Aspen cervical collar provides effective motion restriction without the heat buildup and discomfort of other cervical collars. Its airflow design and breathable pads allow moisture to evaporate, while its unique construction allows it to conform to each patient's anatomy, thus producing a custom fit that greatly reduces the possibility of skin breakdown and increases the potential for improved patient compliance. For the next few minutes, we'll be discussing the features and benefits of the Aspen collar system. We'll begin with a brief overview of skin breakdown and the rationale behind the design of the Aspen collar. We'll then discuss sizing and application, proper skin care, pad removal and replacement, and modifications that, if needed, can be easily made. We'll then go through the patient handbook and conclude with a brief review. Skin breakdown, or the formation of pressure ulcers, requires two things: pressure and time. While the skin can easily tolerate high pressure for short periods of time, if the capillary bed is compressed for an extended period, oxygen and nutrients are prevented from reaching the cells, and waste products produced by the cells are unable to be eliminated. If this pressure is not relieved, research has shown that skin breakdown begins to occur in as little as 2 hours. Research has also shown that in most patients, pressure of as little as 32 millimeters of mercury is sufficient to collapse the capillary bed. While pressure and time are all that is needed to create skin breakdown, the addition of heat and moisture compounds the problem because a warm, moist environment supports the growth of bacteria. Bacteria accelerate the rate of cell death, produce an unmistakable odor, and increase the risk of infection if skin breakdown has occurred. The Aspen collar has been designed to provide effective motion restriction while minimizing the possibility of skin breakdown. A study published in the Journal of Trauma confirms the fact that the Aspen collar supports the head without creating localized pressure points. It does this by the use of flex tabs, which allow the collar to automatically adjust to each patient's anatomy. These tabs support the chin piece and line the lower edge of the front panel as well as the upper and lower edges of the back panel. These flex tabs allow the areas of the Aspen that come in contact with the patient to conform to each patient's anatomy to provide essentially a custom fit. The fit and comfort of the Aspen collar is further enhanced by the patented occipital support strap, which cradles and supports the occiput. Tightening this strap also has the effect of changing the shape of the collar, which subtly adjusts the areas of contact beneath the patient's mandible. Since the chin piece carries much of the weight of the patient's head, the ability to make adjustments in this area without the need to loosen the collar itself can be a real benefit. To prevent the buildup of heat and to allow moisture to evaporate, the supporting structure of the Aspen collar stands away from the patient's neck and features large vent holes in both the front and back panels. These allow for the circulation of air, which, along with the breathable foam used in the skin contact pads, dramatically reduces the heat buildup typically associated with older collar designs. This is especially important as research has shown that the elevation of skin temperature by as little as 1 degree centigrade significantly increases the metabolic activity of the skin and hence the likelihood of skin breakdown. To make maintaining the collar in a sanitary condition as easy as possible, these breathable pads are removable. Just pull off the soiled pads and replace them with a fresh set. For any collar to provide optimal support, proper sizing and proper adjustment are critical. The adult Aspen collar is available in 4 heights: short, regular, tall, and extra tall, while the children's collars come in short and regular. To simplify size selection for the adult collars, a sizing card has been produced. With the patient in a neutral position, hold the sizing card parallel with the spine, touching the patient's ear and resting on the trapezius. Now sight along an imaginary line from the bottom of the patient's chin and select the indicated collar. For this patient, a tall is the correct size. Having selected the correct size, start by preforming the back panel by rolling it up which forms it into a curve. To apply the Aspen collar to an upright patient, begin by flattening the collar against the patient's chest and sliding it upwards to support the chin. Now, bend the side panels up and onto the shoulders next to the neck. When properly positioned, the patient's chin should come to, or almost to, the front edge of the chin piece. If it is difficult to properly position the chin piece, consider the use of a shorter size. With the chin piece in its proper position, grasp the back panel so that the occipital support strap is at the top, and place the back panel behind the patient's neck. Position one of the Velcro straps to align with the hook Velcro and press the two together. Moving to the other side, repeat this process. With the back panel loosely attached, tighten each side as needed so that the Velcro straps are even and the collar fits snugly. Note that to properly engage the occiput, which prevents the chin from slipping off of the chin piece, the collar must be applied tightly enough to deflect the flex tabs on the back panel. After tightening the collar, take a moment to ensure that the proper size has been selected. The patient's chin should come to the edge of the chin piece, but the inner trach bar should not touch the anterior neck area. The final adjustment is to tighten the occipital support strap. For an upright patient, this can dramatically improve the comfort of the collar. To do this, squeeze the sides of the back panel with one hand while you release the occipital support strap. Tighten it by pulling firmly towards the patient's ear. Now wrap the end of the strap backwards and secure it to the hook Velcro. Note that because the occipital support strap is a single strap, it can be adjusted from either side, whichever is more convenient. At this point, ask the patient if the collar is too tight. If the answer is yes, loosen the strap just slightly. So that you can have an understanding of how the tightness of the collar and the support relate, have a colleague fit you with a collar or apply the Aspen to yourself. Tighten the occipital support strap to feel how it supports the occiput and shifts the support areas under the mandible. Before removing the collar, over-tighten the side closures and then loosen the collar until it is again comfortable. As with an upright patient, hold the sizing card so that it is parallel to the spine, touching the ear and in contact with the trapezius. Next, sight along the imaginary line from the bottom of the chin to determine the correct size. For this patient, a regular is indicated. When applying the Aspen collar to a supine patient, begin with the back panel. As before, orient it so that the occipital support strap is at the top. Supine patients do not benefit from the use of the occipital support strap, so be sure that it is not tightened. Now, position the back panel by pressing down on the pillow or mattress and sliding the back behind the patient's neck. With the back panel centered, slide the appropriately sized front panel up the chest wall to properly support the chin. Now, position the sides of the front panel over the shoulders, align and tighten the side closures, making sure to take out all of the slack as previously described. Also, be sure that the Velcro straps are adjusted equally, which ensures that the back panel remains centered. Note that the proper size for a supine patient may be one size shorter than the correct size for that patient when they are upright. This is due to the fact that without gravity's influence, the shoulders tend to ride up. For this reason, changing to a taller size may be appropriate as patients improve and become ambulatory. While the standard back panel that is packed with each adult collar is generally preferred, for certain patients, especially those who are unconscious who are expected to remain supine for an extended period, a special low-profile back panel called the small back is available. This shorter back panel reduces pressure on the occiput. It works with any of the adult-sized collars and can be purchased separately. The The Aspen collar comes in two sizes developed especially for children. The child short fits most children age 1 to 4, while the child regular is intended for children age 4 through 8. Application of these collars is exactly the same as described for adults. A child-sized collar may also be appropriate for patients who are extremely thin or frail, where an adult collar has too large a circumference. Proper skin care is critical in the prevention of skin breakdown. At least once a day, the collar should be removed and the patient's neck and face thoroughly cleaned. Typically, this is done with the patient supine. With another person holding the head in neutral alignment, remove the collar and gently wash the patient's neck and face with an appropriate cleansing agent. Carefully dry the neck while looking closely for any signs of irritation. If redness is noted, consider modifying the collar, which we'll discuss in a moment. After replacing the pads in the front of the collar, as described next, reposition the front and log roll the patient, being careful to maintain the spine in neutral alignment. Now, wash and dry the back of the neck. Be sure to note in the patient's record any skin breakdown or irritation noted and what steps were taken to address it. So that maintaining the Aspen collar in a sanitary condition is as simple as possible, the padding is easily removed and replaced. The two front pads are simply peeled away from the Velcro dots that hold them in place. With the back panel, begin by pulling the Velcro straps out of the slots at either side of the collar. With the pads removed, if necessary, the collar should be wiped down with an appropriate cleansing agent. Replacement pads come in color-coded sizes just as the collars do, so begin by selecting the correct size. Orient the chin pad so that the gray side will make contact with the gray Velcro dots and fold it in half. Now, starting in the center, align the pad so that it extends evenly over the edges of the chin piece, adjusting it as necessary. Follow the same procedure to replace the lower pad. Start in the center and work outwards. To replace the back panel, begin by passing the Velcro straps through the slits in the pad and then lace them through the slots at either end of the collar itself. The pads may be cleaned and reused if this is allowed in your facility. To do so, thoroughly wash the soiled pads with the patient's facial soap or cleanser. Rinse them, wring out all excess water, and allow them to completely dry before reapplying. If a patient shows signs of irritation, check to see that the foam pad is properly aligned. If any of the plastic edges are exposed, reposition the foam pad. If this is not the case, one or more of the clear flex tabs can be cut off using a pair of scissors. If the irritation is in the center of the occiput, in an ambulatory patient, you can tighten the occipital support strap so that the upper edge of the back panel does not make contact with the occiput. In a patient that is supine, the use of the shorter back panel will generally correct the problem. International Healthcare Devices has created a patient handbook to help patients understand and accept the need for motion restriction. This 8-page booklet explains the importance of limiting the motion of the head and neck. It also explains the importance of proper skin care and how to safely remove the collar, wash and dry the skin, how to replace the pads, and how to reapply the collar. Since not all of this information will be appropriate for all of your patients, the booklet also includes a checklist that allows you to specify for each patient how long the collar is to be worn, when the collar may be removed, and how this should be done. A space for special instructions is also provided. An improperly sized or improperly tightened collar can end up around a patient's nose. To prevent this, make sure that the correct size collar is selected and that it's positioned so that the patient's chin comes to or almost to the end of the chin piece. If it is necessary to reposition the chin piece, rather than attempting to push the chin piece inward, begin by releasing one side of the collar and pivoting the front downward. Now, flatten the front portion against the chest and pivot it upward so the chin piece is properly positioned. When tightening the Velcro straps, position your thumb in the corner of the trach hole while using your fingers to hold the side of the front panel snugly against the neck. Tighten and attach the Velcro strap with your other hand. Do this on both sides until all the slack has been taken up. If, after tightening the collar, the patient's chin extends beyond the end of the chin piece, or the inner trach bar contacts the neck, replace the collar using a taller size. Your best guide to tightening may be the individual patient. After tightening the collar, ask if it is too tight or if it can be tightened further, and let them tell you. If it is too tight, loosening it by as little as 1/2 inch can be enough. A careful inspection of the patient's skin whenever the collar has been removed is critical. If localized redness is noted, check to see that the pads are properly aligned. Remove one or more of the flex tabs as necessary, or switch to the small back. While most patients are best fit with a regular or tall collar, properly using the sizing guide is important. To ensure that the correct size is indicated, keep the sizing card parallel with the spine, touching the ear, and resting on the trapezius. The Aspen collar provides effective motion restriction without the heat buildup and discomfort of previously available cervical collars. Its airflow design and breathable pads allow moisture to evaporate, while its unique construction allows it to conform to each patient's anatomy, thus producing a custom fit that greatly reduces the possibility of skin breakdown. International Healthcare Devices is committed to producing the finest extended wear collar system available and to assuring that it is used properly. To this end, IHD's policy is to provide personal in-service training for the staff of facilities that standardize on the Aspen collar. To arrange for an in-service training program or to get additional sizing guides or patient handbooks, contact your Aspen collar supplier or call us directly.